The cost of any future COVID-19 becomes critically important as companies and governments race to produce a safe and effective immunization before the end of the year at the very earliest. In a conversation with the SABC's Sherwin, Bryce-Pease, a leading US-based public health advocate has raised concerns that wealthy countries could get priority to any new vaccine, whilst further arguing for why it should be cheap or free for everyone, everywhere.
What is the vaccine development landscape looking like globally at this time, and how is it affecting the development of a COVID vaccine? Are you seeing differences in the responses given, the differences between the global north and south, for example?
There have been significant differences between the global north and south. As I mentioned, there are just over 100 possible vaccines currently in development. The two that have gotten quite a lot of attention is Moderna in the US and the University of Oxford in the UK. However, it must be stated categorically that there's currently no vaccine, treatment, or preventative medicine proven safe or effective for COVID-19. These are all experimental, and the time frame within which this may become available has been estimated at anything between 12 and 24 months, depending on who you talk to. So what we recognize is that the vaccine development process is a slow, cost-intensive process, and we're not entirely sure when it's going to become available. That context...
People are saying before the end of the year.
So this is what Oxford has been suggesting, that there's going to be a vaccine available by September. But if you read the fine print, you'll discover that what's currently happening is that AstraZeneca, which is the pharmaceutical company they've partnered with, is starting the manufacturing of the vaccine before it has been proven effective. The basis of the vaccine is technology that has never been used before. There's also a question of how and where the vaccine gets manufactured. And so there are a number of complicating factors that we need to think through when we think about the time frame. So I recognize that people have been saying it's going to become available earlier, but I'm not sure how effective that's going to be. So that's the first point. There are two others which I think is critical. The one is, what is it going to cost? And so the price point is an important one, and there's been no indication of what the Oxford vaccine or the Moderna vaccine, if it becomes available, is going to cost. And I think this is an area we are deeply concerned about. And then the third dimension is, who will be able to access the vaccine? We've seen that because of US and UK investment in the Oxford vaccine, that guarantees have been made to give access to those countries first, which is counterintuitive to this idea of global solidarity. And so we need to think through, why are the wealthiest, most powerful countries in the world first getting prioritized access to these vaccines? And what does that say about the power dynamics in the global north and south?
Yeah, I had a conversation with the UN Secretary General about this very issue, and he said, although he can't give an assurance, he'll do everything in his power to ensure that there is equitable access. But of course, you do touch on the notion of whether a vaccine will be able to be free or not, or accessible or not. How do we ensure that it is accessible? What needs to happen for that to become a reality?
So there's already been an initiative led by the UN and UNAIDS in particular for what they call a people's vaccine. It's a set of principles that was signed by a number of world leaders, including President Ramaphosa in his capacity as chairperson of the AU and as president of South Africa. And the idea behind the people's vaccine is sort of threefold. First, that we have to ensure mandatory worldwide sharing of all COVID-19 related knowledge, data, and technology. Secondly, that we have to establish a global and equitable rapid manufacturing and distribution plan, which must be funded by wealthy nations. And third, we have to ensure guarantees that the vaccines, diagnostics, and tests are going to be free of charge to everyone, everywhere. So the principles have been established. The question, of course, is, how do we implement these principles? And what I've seen so far is that a number of countries have invested heavily in developing the vaccines and in thinking through manufacturing. But this coordinated response is what is going to be required, and we have not yet seen how that is going to be playing out on the question of the people's vaccine.
When you talk about a coordinated response, what are you talking about? Are you talking about the pooling of resources? Are you talking about countries giving it away for free, that there'd be no profit taking? I mean, what does that really mean?
I think the idea of profit is an important one. We must acknowledge that about 60% of the costs that go into vaccine research and development is publicly funded money. It comes from state coffers, from taxpayers who give money to the government and then who in turn fund universities and centers of research and development. So there should therefore not be a high cost attached to vaccines when they become available. Governments should be able to access those at a reasonable cost, and then governments must be able to provide those vaccines free of charge to local populations. And I think it's certainly been done in the past. It can definitely be done here. This is a particular moment in which the question of cost becomes critically important, and we don't want to follow the biomedical model that we have in place, which puts profits before people. What we must ensure here is the idea of a people's vaccine, which ensures everyone has equitable access to the technologies that we are already publicly funding.